You know, what the gentleman said was a one-size-fits-all answer. The fact is, when I first spoke on this amendment, similar amendment about DEA and marijuana, it was about a gentleman named Oral James Mitchell, Jr., a Navy SEAL, served this country in Vietnam, and died in 1996 of pancreatic cancer. And he violated the law in 1996 in the state of Maryland because he used marijuana to ease his nausea. And also, as his mother said, it's the only thing that allows Oral to smile and to eat. He didn't like the Marinol. He said it didn't do as much good as smoking marijuana. And when we're talking about somebody who has cancer and wants to use marijuana to improve the condition they're in and suffering from the nausea, and there's a lot of evidence that it's better than Marinol, then we don't have to worry about the situations that the doctor mentioned about possibly causing somebody heart disease over a period of years, which we know tobacco does, and it's sold all around and legal. We're talking about saving people pain, and we're talking about a VA doctor being able to distinguish between allowing somebody who might be in the last months or years of life and alleviating their pain with one of the best agents known to man to do that, rather than a situation where somebody might be young. We don't have that many veterans who are as young as the AMA study discussed and their ability to think. That was talking about kids who are teenagers. They're not veterans. So I would submit that there are times the doctor should have discretion. And we're not talking about the doctor dispensing marijuana. We're talking about a directive from the federal government prohibiting the doctor from saying, I think like Dr. Fleming, and I don't think you should use marijuana. I don't think you should go to another physician, if you could afford it outside the VA system, and try to get him to give you a directive to where you could go and get marijuana. This prohibits the VA doctor from allowing Dr. Fleming, if he worked at the VA, to tell his patient not to do it. The VA doctor should be able to speak the truth, and this is censorship by our federal government, a directive, which I think most of the people on the other side of the aisle have certainly been against federal government influence in medical policies and have done all they can to stop the federal government from influencing medical decisions. Here's a situation to where you're saying the doctor should be censored. So there's a lot of evidence that medical cannabis helps, but particularly with nausea. And I know the Speaker Pro Tem knows people in East Tennessee, as I know in Memphis, who have contacted me and asked me to allow them to be able to get medical marijuana. They can't do it in Tennessee yet. They'd like to do it in Tennessee at the veterans hospitals. But where it's legal in the state, the doctor should not be muzzled and censored. And this Congress should be in favor of the freedom of speech and the favor of the doctor being able to use their best efforts to help their patients and exercise their Hippocratic oath to do what they think is best, which may be to say no. I'd like to yield to Mr. Blumenauer to add to this discussion, because he was exactly right. This doesn't say anything about dispensing marijuana. It doesn't say you're for marijuana. It simply says you allow the VA doctor to exercise their judgment.